All right, guys, welcome back for another episode of the Barbell Therapy Podcast. I'm your host, Dr. Brett Scott, and with me today is my new young Padawan here, Dr. Connor Bombaci. So, Connor is the newest physical therapist at Barbell Therapy, and he's been a great addition to the team so far. So, Connor has a background not only as a doctor of physical therapy, but has a background as a collegiate Division One strength and conditioning coach and is also a certified strength and conditioning specialist. So, Connor, welcome aboard.
Happy to be here.
Welcome to the podcast, and we look forward to talking about this topic tonight. So, something we wanted to go over, which has been a hot topic for us lately, is the importance of hip mobility and even just mobility in general. So, we're actually doing a workshop coming up on October 23rd at Barbell Therapy and Architect Fitness in Tingsboro. So if anyone has any questions on that, feel free to reach out. Look it up on Instagram at barbell.therapy or shoot us a message or an email. You can email me at brett@barbelltherapyandperformance.com or check out our website and shoot us an inquiry there. So something we've seen a lot of, and we see a lot of as the types of providers we are, is we see a lot of hip impingement, we see a lot of low back pain, and we see all kinds of things around the hip joint and the lumbar spine as we're dealing a lot with weightlifting, powerlifting, CrossFit, and a bunch of weekend warriors too. And my thoughts on hip mobility have changed a lot through the years. The way the literature goes, the way my practice has gone, the way my skills have increased over the years, and my understanding of what mobility is, and my understanding of what other people's understanding of mobility is has also changed vastly over the years. So I kind of want to set the record straight on what people need to know. So whether you're a high level athlete and you're trying to improve your performance, or you're a coach, this will be a good podcast for you to listen to. So we're going to do this in two parts. One is going to be pretty simple, the bare bones of the basics of mobility and why optimizing hip mobility can be important for you or your clients, as well as part two, which will go more into the depths and maybe down some rabbit holes
A
and
little
some rant.
sciencey.
Yeah, we'll get a little more sciencey in part two about my thoughts on the field and where it's going and what we're seeing and how we clinically can look at some of these things in a very sharp lens. So, first off, I want to answer the question of what is mobility and what isn't mobility. So, mobility, simply put, is how we move around, how well we do it, or how we do it, and the behavior we have. So, this can be from a total body standpoint. So, we can consider mobility us going up and down stairs, us getting in and out of bed, things like that. We also think of mobility, especially in the sports realm, more on the spectrum of how much flexibility do I have, or how well or easily can I move. And there's a lot of context to this that I think is misunderstood by people. So if we look at gymnasts, we look at dancers, we look at a lot of weightlifters too, we see a ton of joint mobility. However, that doesn't necessarily mean this person has full mobility. So there's various types of mobility. So when we look at a joint, we need to differentiate a little bit of what mobility is, or what type of mobility this person has or doesn't have. So from the very beginning here, we want to kind of define those terms. So a lot of people confuse flexibility and mobility too. So flexibility on its own, we're looking more at tissue length, right? So if I can put someone on their back and I can lift their leg up and their hamstring, can go way back and say this person's a gymnast or a dancer, they might have, and typically will have, a lot of hamstring flexibility. Now, that doesn't necessarily say they have really good hip mobility too. Because a lot of times what we see in these individuals is they actually have really tight hamstrings, or they think they have really tight hamstrings. And what we find is this difference in active range of motion of a joint and passive range of motion of a joint, or even a pattern, right? So I might be able to get someone's leg up off the table up to 90 degrees, right? So that's good. That might be good flexibility for that person, but they might only be able to get their leg up maybe 55 degrees or so.
Hey,
And then
Brett, just for the crowd at home, real quick. So you're telling me it's passive versus active right now?
yes, passive versus active range of motion, right? And sometimes depending on what we're looking at, so like the hamstring crosses two joints, so that would be tissue length of a muscle, right? And so we can look at it from this pattern based of this muscle flexibility. And we also can define that as resistance to passive stretch. So someone can have a lot of flexibility versus active and passive range of motion as well. So someone can have a lot of passive hip flexibility, as many dancers, cheerleaders, gymnasts, and weightlifters will have, right? But if I ask them to raise their leg or flex their hip and do some of these things actively on their own, they might not have any control of that. And what we see there is what we would say is we might be lacking in a little bit of control. And when we lack control, we create this neurological stiffness within a joint, right? To protect the body. And what I tell patients and clients a lot is your nervous system basically acts as the ABS system or the ABS braking system in a car. So
Rip that e-brake.
yeah, so if we're going around doing all these high level tasks and our body from a fundamental base level doesn't have full control of that pattern or those parts, it's going to tell the body, whoa, 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 pump the brakes. I don't want to move there and I'm not going to let you move there. I'm going to do my best to not let you move there because we don't have good control over it. And so someone can have all somebody somebody can have all the mobility in the world or passive joint mobility,
There it is.
but if they don't have active control, they will sometimes find themselves in um, pain. For one, they could get injured too. We see this a lot in weightlifters, especially more on the female side, where females just generally tend to have more joint mobility and passive joint mobility.
So wait,
But a
you're
lot of
telling
them,
me that there's such a thing as too much mobility? I
there
thought we
is
want
such
all
a
the
thing
mobility
as,
in the world.
yeah, so we can have plenty of passive mobility. And if we're lacking active joint range control, we can run into issues there. So what we see a lot, especially with overhead athletes, is we can have a shoulder joint or what we call a glenohumeral joint, and it can be very mobile. I can passively bring someone's arm all the way overhead, but if I lie them on their belly and I can still get their arm all the way overhead, but they can only barely, if they can barely lift their arm off the table, and then we start throwing them into a snatch, we have to take a step back and go, whoa, maybe they're not ready for this. Maybe there's some fundamental prerequisites we need to look at to get them moving better so that we don't run into issues down the line. Because some of these things, too, aren't right on the surface. We're going to start to feel pain. This could be 6 months, a year from now, where we'll start to run into pain. And the other thing we need to recognize is what the science says about mobility and range of motion and demands of sport. But what people aren't really understanding, from my perspective at least, is that they're not fully understanding the difference of specificity for sport and the need for health, daily life, long term resilience. So I used to be someone that used to say, stretching is kind of overrated and we don't really need it. And then, um, you know, I compete in Olympic weightlifting and I did pretty well in it, but I've always been a fairly stiff guy anyway. So I have an arthritic condition myself, and I've dealt with that. And weightlifting actually helps me with that, probably more than anything else, because it forces me to get into positions that are more towards end range. So I have to keep up with my mobility training. But I recently took the functional range conditioning course, and it kind of changed my whole perspective on stretching, mobility training, what it all is, and why it's so important. Right. So a lot of the research says, and a lot of clinicians and some of the thought processes in the field say mobility is important. We don't need to train mobility. You can just warm up under a barbell, you know, um, just train and load it. And if we just keep loading it, it'll get stronger and the system will adapt. Right. And in some situations, I believe that is true. I believe smart training is definitely number one on our priority list, to prevent injury in the first place. And I don't think everyone needs to go see a PT and be pre screened for these things. However, if we are having issues, I think there's a missing piece in the field right now. So a lot of sports physical therapists and a lot of movement providers in general are saying, yeah, just unload for a little bit and then gradually bring it back up, and bring your load back up, and calm down for a little bit and just build back up and you'll be better. Right. And I was really on board with that for a long time. And pain science says that too. And I think there's a lot to pain science that a lot of people don't understand. And now I'm kind of seeing the pendulum swing back the other way towards, hey, you know what? Biomechanics do still matter, and hip mobility and shoulder mobility and just mobility in general does matter, right? So the big thing we need to realize is you can't move where you can't move. And I will repeat that again. And somebody out there, write it down. You can't move where you can't move,
Oh,
right?
anatomy matters.
Anatomy does matter sometimes, and not always. And this is where it comes down to specificity of sport versus life, daily health, joint health, and long term wellness, right? So we can look at powerlifting versus weightlifting is a great example of this, actually, right? So weightlifting is a sport, and by weightlifting, I mean Olympic weightlifting. So the sport of the snatch and clean and jerk. So two sports that require a fair amount of strength and also a high level of range of motion. Okay. And then we have powerlifting, where we're trying to create athletes that have the ultimate stiffness to move the most amount of weight and actually the shortest amount of range, which weightlifting, we're moving the barbell as minimally as possible at kind of extreme ranges of motion. However, powerlifting, we're getting pretty stiff and we're creating stiffness to then move the most amount of weight possible in the squat, bench, and deadlift, which on the surface don't require nearly as much mobility as a high level weightlifter would need. Okay. So, point being here is for the demands of sport, weightlifting totally needs more mobility training than powerlifting, right? If you want to be a good weightlifter, you can talk to any weightlifting coach out there. They're going to tell you mobility matters, and every weightlifter should probably be training mobility in some way. Now, there is a great difference in that between weightlifters. So, my mobility training, where I am someone that's very stiff, I need to just improve joint mobility. So I need to improve the stiffness of my joints to improve the functionality of my functional range of motion so that I can actually move my joint further than it typically wants to go. And that's something I constantly need to work with. So for me, it's long term passive range of motion, mobility training with some active range of motion at the end to hit save on the document. Now, if I have a very flexible female weightlifter that I can lift her arm all the way overhead, or I can bring her foot all the way overhead and stretch her hamstring and her hip, but she can only do 50% of that, well, her mobility training is going to look a whole lot different than mine because she needs active range and just active range control of her joints, and she needs to learn how to stabilize her joints, where I need to get the tissues of my joints to be more extensible to move more so that I can get under a bar faster and more easily and in a more elastic manner.
So, Brett, I
Okay.
think a lot of people would have a good idea of what your warm up would look like. Describe what her warm up would look like as compared to yours.
So we'll take, say we have, and I'll put this in terms of, yes, I have a female that can easily, her hips have more than average range of motion. So she has plenty of flexion, external rotation, internal rotation. It's outside of the normal range. So she has increased range of motion of what we would find in the common human being, right?
Passively.
But passively, but she doesn't have anything active.
Mm-hmm.
So for that individual, I'm going to give a whole lot of joint control stuff. And this can start with just basic what we call CARs, which is controlled articular rotation. So this is part of the functional range conditioning and functional anatomy seminar stuff, and you can find them online, and they have a bunch of good stuff. But basically, it starts at a daily level of daily joint care and daily joint maintenance and control of bringing a joint through its full range of motion and trying to achieve maximal control of that. And that can be as simple as bringing your shoulder up overhead and bringing it all the way back and learning to fully articulate that range of motion. And as you practice that, you'll get uh, an acquired sense of active range of motion. We also have things which I use a lot with many people that have this is what we call pails and rails. So progressive angular isometric load and regressive angular isometric load. Okay. So with that, what we want is um, I'm getting them to their end range of that they control, and I'm having them push their joints in both directions, essentially. So for a hip, essentially, I'm going to get them into that 90-90 position, or a jujitsu position, as some people would like to call it. And I'm going to have them, they're not going to sit there and stretch. I'm going to have them sit there in that end range for them, and I'm going to have them push their leg down into the floor, right? I'm going to have them hold that for 15 seconds. And then once they're done that 15 seconds, they're going to relax. And then I'm going to have them try to lift that leg off the floor. So I'm getting them to learn to acquire range on both sides. And there's various different ways to do this, but that's one of the ways.
And
The
it's
other
all
thing,
active.
and it's all active, and it's hard too, and that's where the difference between stretching and passive stretching versus mobility training comes in, right? So we'll start with those things. So those are our kind of fundamental baselines we want to look at, and then from there, from a training perspective, I want to look at just progressive loading of barbell movements. So yes, we can use load as something that's going to stabilize, and we need to learn to stabilize it, but I want to make sure we're doing it in ranges we can control first before we go into ranges we can't control. So for a hip per se, if someone doesn't have great hip stabilization or weight bearing stabilization, right, I'm going to start with them in kneeling, and we're going to go after chops, lifts. We're going to work on closing um, that line of that base of support to put them in a straight line like they're on a tightrope if they can. And we're going to dynamically move, a kettlebell. So we can do kettlebell halos as well. But I'm going to move my center of mass over my base of support and see if my hip can learn to stabilize that. And
Mm-hmm.
then we can start going into other more demanding exercises, like a great mobility exercise for some people is going to be a single leg deadlift. As simple as that, right? It can be it is for a lot of people too. Bottoms up kettlebell presses, stabilization exercises with a bamboo bar, where I have someone start to learn to press the bamboo bar. So you have the kettlebells on the edge of the bar, and the bar is actually made of bamboo, so it oscillates quite a bit. And they'll bring that overhead, and I might have them to start with walking back and forth and learning to control new ranges of motion with very minimal load compared to what they would be snatching or putting anything overhead as a competitor, just to learn better joint control. And essentially, what we would look at this as is reflexive stabilization. So, for many people, that can be a form of stability training, which is also mobility training because it's training active range control,
Mm-hmm.
right? Um, so that's where we're going to look at that with people that need mobility training that have joint mobility, they just don't have control, right? So the other thing we need to think of too is this. you can't move where you can't move, right? And so some people say, yeah, you had sciatica or you had this, shooting pain down your leg. Just let it cool down and come back to it. Well, why did this happen in the first place? If I do an evaluation on someone, and we've had this a couple times in the past few weeks, is people came in that uh, do work out, and one of them was a power lifter actually, and they only squat to 90 degrees. They only squat 90 degrees to go to the bathroom. They're never going past that. So they don't have this full joint range of motion anatomically that they were given. They only are working in this functional range, so they've lost a lot of that range of motion in the hip, right? And now this person had to go out for work, and they had to lift a bunch of boxes of tile, I believe it was, into the back of a truck. So from the ground, repetitive kind of, flexion demanding activity, which this person doesn't typically train either, right? And now what we found with this person is they actually had hip dysplasia, and they had minimal flexion, minimal internal rotation, and minimal external rotation of their hip. So this person's right hip really hasn't moved at all, and they have to bend over. Now, what we have to keep in mind is when there's a goal at hand with our brain, we're going to get the task done no matter how we have to get it done if we're motivated to do that task, right? And if you can't move from your hip, your body's going to find another way to do that. And this is where training and mobility for training differentiates from joint health for long-term wellness and resilience. So this person couldn't flex enough from their hip to get down that low to pick up these boxes. They had to flex from their spine, which flexion can be okay if it's trained and if we've built it up enough, but only if it's trained. This was an untrained range of motion. This person didn't have any mobility, and so they didn't have any variability, and so they didn't have any options. And so the back got pissed off enough to say, you know what, we're done. And we're going to let you know that by starting to send some shooting pains down your leg to make you stop essentially and put a halt to this activity, because this person just didn't have any hip mobility. And he didn't know he didn't have hip mobility until he came in for his evaluation. And we found out I couldn't flex his hip. He couldn't flex his hip. He had to do it from his back. So, yes, we got the sciatica to calm down and removing painful triggers like flexing all the time and giving him different movement options. But we still need to improve the mobility of that hip, right? Because the other thing we need to think about too is with these sports, we haven't quite met Mr. Arthritis yet, right? So if a joint isn't fully moving to its full range every day, we start to see changes in capsular length, the joint mobility itself of the capsule, the surrounding tissue being the muscles like the glutes and things like that, which if those can't move, we don't have options. And I was actually sitting out, I had to build a shed last weekend, and luckily I've been working a lot on my hip mobility lately actually, and I was able to sit in a squat for prolonged periods of time because I had that option, right? But if I didn't have a hip that could flex like that and ankles that could flex like that, well then my back was going to have to do a whole lot more work. And when we overload one thing just over and over, if I just keep picking at the same spot on my arm for hours on end, we're going to start to form some type of wound, right? It could be a blister, it could be a callus, it could be deeper than that. And the same thing happens within our body, and we need to think of those things. So, really getting into joint control and joint maintenance and daily self care of trying to achieve some type of improved mobility in whatever standpoint you think you might need is going to be crucial to long-term health. Because, yeah, you might only need to squat down to 90 degrees of hip flexion, but when you have other things outside of powerlifting that matter to you, and we just want to feel good, there's a lot there. And in part two, I want to go down the rabbit hole of some of the science behind the neurology and physiology of why daily joint care matters and just trying to work on mobility matters, right? And this doesn't mean you need to have maximal, 140 degrees of hip flexion for everything, but depending on your lifestyle, it might, right? And so, Connor, do you have anything you want to add at this point?
The only thing I want to touch upon too is something sympathetic regulation. Where are we going with that? Talk to me. Because I
Mm.
know me, like if I tense up and I stop breathing, stop learning. Heard that this weekend from some really smart people. So talk to me.
Yeah, so that's the other part is we hear all the time in the clinic, and I've heard plenty of times of, yeah, I've stretched and I've tried stretching all the time and it just doesn't work. And I used to think, and I still kind of think, the generic term stretching doesn't really work. Um, Mainly because we're doing it wrong. And 95% of individuals don't really know what stretching is, what the science says on it, what it's actually doing. And we just need to execute it better. So we see stretching, and I see stretching or define stretching as just passive, you throw your leg up and you feel the stretch in your hamstring and you sit there for 30 seconds 3 times. And that's typically what people get in a physical therapy clinic or in like a traditional insurance based clinic, right? And um, that's not always doing a whole lot for us because we're not putting ourselves in the state to actually stretch, right? And the data on stretching is mixed, right? And we see that sometimes people will feel better with stretching, especially temporarily, because what they've done is they've essentially just improved their tolerance to a lengthened position. So they've just become accustomed or acclimated to that position, right? But that doesn't mean we're changing tissue length, right? And the new data on this is showing that actually we can change tissue length and we can make the length of a physical muscle tissue or tendon or ligament longer and more robust, but we need at least 2 minutes of passive load on that to lengthen a tissue. The other thing with this is how are we stretching, right? So, for one thing, we need at least 2 minutes in that position prolongedly, right? And um,
Quick
there's
caveat to
certain
that.
yes,
So to make physiological change, it takes 2 minutes. But to make a quick kind of nervous system reset, hypothetically, if we're in a warm up and we're just trying to almost change the sensation that one of our lifters is feeling in a warm up, if it's we give them say like a latch stretch for 15 or 20 seconds, we're just changing the sensation of what they're about to feel during a lift. So there is still a use to it. It's just kind of knowing when to and when not to.
yeah, and we can touch upon that in part two as well. Actually, that's a really good point. So write that down in our notes here.
Going down the
Uh,
notes.
but what I'll say about this sympathetic regulation piece, right? So when we're going into a stretch session or a mobility training session, we need our mind to be right, right? We need to be focused and we need to be there. Um, but we also need to be relaxed. So a lot of people will try to do these stretches and they're fighting themselves and they're fighting their nervous system. And what we really need to do is first, let's start with like 2 minutes of breathing, right? Let's let's regulate the nervous system. Most of us work stressful jobs. We're busy all day. We don't get to stop. We need to slow down. So even just 2 minutes of what we call box breathing can be a huge help, right? So something like breathe in slowly for 5 seconds, hold that inhalation for 5 seconds, then exhale slowly for 5 seconds, slowly empty the tank, pause in that exhaled state for 5 seconds and hold that, and then inhale again for 5 seconds. And so we call this boxed breathing, and we can do this to really just get the nervous system to calm down. And that's just one breathing technique, right? And then when we go into our stretching, let's be mindful of the state we're in. So when you're stretching or you're starting a mobility training session, rather, is think about what your face feels like. Is your forehead grimacing? Is your jaw super tight? Are our hands clenched? Are we, like you said, are we breathing? Right? If my face is in this state of terror and just this fight zone,
We've done something
uh,
wrong.
I'm in a sympathetic state and I'm creating neuromuscular tension on my body, right? And if I'm not, like you said, if you're not breathing either, our body can't learn and our brain can't learn. and we're not relaxing. So we're literally sitting at an end
Shout
range,
out Mike Perry.
just, yeah, we're just fighting tension, right? We need to be relaxed from a neurological perspective, systemically, to actually get a muscle to relax into a point of length. Because if it's scared, if you're super tense, you're not actually stretching it, you're just holding it at end range, right? We want to coax the nervous system into letting it know that it can extend further than it has or lengthen more than it has in our current state, right? So these are the big things we want to think about, and these are actually some of the things we're going to kind of cover in our mobility training workshop. So we're actually going to get people, on the ground, stretching, breathing, focusing on some of the little intrinsic pieces to what it takes to make the most out of your mobility training. Because I do think people waste a lot of time on it too, and there's plenty of nuances to in contextual factors to mobility training. But those are some of the big things, and I think the key takeaways here is, we'll just kind of summarize these before we move into part two. So we're going to go into, you have active versus passive range of motion, and you have flexibility, right? So we need to figure out for ourselves and our clients, does this person have active range? Do they have passive range, right? Can I move them to a greater degree of range of motion than they can, right? And then if I can't move passively or actively, I probably need to do a lot of stretching, right? Or lengthening and time under tension to lengthen tissue, and then do those pails and rails we talked about, right? And these things all matter for long-term joint care because these give us options for everyday tasks and things that are going to happen out of the blue, so that we have that variability, and we basically have insurance for our body, that we're not just running down one system or one pattern or one part, right? We have multiple patterns, multiple parts. Can we distribute stress evenly through those different options or avenues we have? Okay. And then thinking about that with either having someone do prolonged holds to increase tissue length, or do they need that active reflexive stabilization type training and active range of control, active lift offs, things like that to improve joint mobility from a control standpoint. And then the last piece there is, what is our mental state going into our mobility training session, right? Being relaxed, being able to breathe, because being able to breathe puts us in a state where we can learn and where we can actually get the body to relax so the muscles can relax and therefore they can lengthen. Okay? So that kind of wraps up this point. Anything else you have to add there, Connor?
No, that's the T right there. Come back for part two, though, if you want on the science.
Yeah, so we'll go on some rants in the second part on some science of this stuff. And if you guys like this episode, please like, rate, and share this podcast so other people like you can find it on Apple, Spotify, and on our website, and basically all the other hosting platforms out there. If you guys have any questions or want to hear more content like this, feel free to visit our Instagram at barbell.therapy, visit our website, barbelltherapyandperformance.com, or shoot me an email at brett@barbelltherapyandperformance.com. Hope you enjoyed this, guys, and thanks for listening.